A gastric bypass, or it's sometimes called a Roux-en-Y gastric bypass, is the gold standard bariatric operation. It's been around for about 30 years, it's an operation we know a lot about, but it's also an operation we're learning a lot about in terms of how it actually works. The first part of the operation involves using keyhole special instruments to form a small pouch of stomach at the lower end of the gullet. This is very similar to the gastric band, but it's done using special surgical stapling instruments rather than placing a band around the stomach. Obviously, the small pouch is going to make you feel full quickly with a small amount of food. But the clever thing about the bypass is that unlike the band and the sleeve operation, in which food is allowed to pass through the stomach and through the upper part of the intestine normally, with the gastric bypass we divert the food onto a different route. And the reason this is so important is that by not allowing food to pass through the upper intestine, it has a profound effect on how the body controls appetite. We all have a normal mechanism, animals and human beings, for controlling our appetite. And this is something that's out of control in many patients who become so big that they need bariatric surgery. The gastric bypass addresses that problem directly by influencing special hormones that the body makes that control appetite. And it's this diversion of food away from the upper stomach that creates that beneficial effect. It's a bit of a myth to think that the gastric bypass works by preventing you from absorbing food. That's just not true. Most people with a gastric bypass maintain really good health and good nutrition, although it is important that you take regular vitamins and minerals such as iron and calcium and vitamin B12 for some people to make sure that you do stay in good shape.